Bismillahirrahmanirrahim. In this lesson, I will discuss about growth in human population and its consequences. Pakistan's population in the year 2014 and 2015 was 189 million. By the end of this decade, our population is expected to exceed 200 million. Pakistan's population had a relatively high growth rate in past. When population growth exceeds the carrying capacity of area or environment, it results in overpopulation. Many problems are associated with human overpopulation. The overpopulated area, severe shortage of fresh water and natural resources. Overpopulation results in and loss of ecosystem. It leads to more pollution and global warming. There is high infant and child mortality rate in overpopulated areas due to poverty. Is the demands for more housing units, more hospitals, more jobs, more institutions, and increase in food crops. We have to check overpopulation, otherwise we will have to face huge problems because of our limited resources. People should be educated about the problems of overpopulation. Pakistan's Ministry of Population Welfare has taken a number of steps to make people aware of hazards of overpopulation and to stabilize the population to match our resources. Carrying capacity of area or environment, it results in overpopulation. Many problems are associated with human overpopulation. I will discuss about AIDS, which is a sexually transmitted disease. Sexually transmitted diseases are defined as the diseases that are transmitted through sexual act. The most serious and challenging health problem faced by the world today is AIDS. It is also a disease. AIDS stands for Acquired Immunodeficiency Syndrome. It is caused by human immunodeficiency virus HIV. The virus destroys white blood cells, which results in loss of resistance against infections. It is a dangerous disease. It spreads through transfer of body fluids such as blood and semen. Thus, the main causes are unprotected sexual activities, use of infected needles, or transfusion of infected blood. According to the United Nations Program on AIDS, UNAIDS estimates some 70,000 to 80,000 persons, or 0.1% of the adult population in Pakistan, are infected with HIV. We will discuss about role of National AIDS Control Program NACP and non-governmental organization NGOs. Pakistan's Federal Ministry of Health established NACP in 1987. The main objective of this program is to help the public for the prevention of HIV transmission, safe blood transfusions, and reduction of sexually transmitted diseases. The number varies, but the frequency of HIV infection in Pakistan is still low. But the country is at the risk of epidemic due to various risk factors. For example, exposure to blood or blood products, homosex, and injection users. The number of drug addicts in Pakistan is currently estimated to be about 60,000 to 5 lakh people who are injecting drugs. For improved prevention by the general public, the NACP started services through TV and radio channels and print media in 2005. The objectives of this activity were to change public attitude for safe sexual activities, create demand for information on HIV and AIDS, and improve attitudes and behaviors among healthcare workers. According to the latest data by the World Bank, at least 54 NGOs are working in Pakistan for HIV/AIDS, public awareness, and for the care and support of the persons living with HIV and AIDS. These NGOs also work on AIDS education and prevention for sex workers and other high-risk groups. NGOs serve as members of the Provincial Consortium on HIV/AIDS, which has been set up in all the provinces of Pakistan. Although NGOs are very busy in HIV and AIDS prevention activities, it is believed that they are reaching less than 5% of the vulnerable population. So that was all about growth in human population and its consequences. Thank you and have a nice day.